I'm gonna
All
go.
right, let's do this. So I do ask everyone to keep their device on mute. Um, this is a standard Zoom meeting, so you're not automatically muted. So if you could please remain on mute until the end of our presentation, and we'll leave about 15 minutes for Q&A at the end of this. To introduce myself again, I'm Jessica Kerwin. I'm with the University of Florida Department of Neurology and the UF Brain Rehabilitation, Neuroresilience, Brain Injury Rehabilitation and Neuroresilience Center here at UF. And we are excited to present today the Florida Brain Injury Action Plan, which will be co-presented by Drew Nagel and Denny Armington with Brain Injury Florida. And I will hand the mic over to them after I provide you with an introduction of how we got here and what we're doing and all the things that we're excited to present to you and to work on over the next few years. So why did we create a brain injury action plan here in Florida? Well, in 2023, Dr. Jaffe, director of the Brain Center, collaborated with Brain Injury Florida to submit an Administration for Community Living TBI partnership with States program grant. So this grant is a 3-year federal grant with the Administration of Community Living that was given to the University of Florida to become the lead state agency for brain injury and to improve statewide collaboration and quality of life for Floridians with a brain injury. As part of that, we conducted a statewide needs assessment, which I will share a few details about. And we developed this Florida State Action Plan for brain injury. In addition, Brain Injury Florida launched the Sunshine Resource Facilitation Network, which includes a telephone line that you can call into. It includes the website and some outreach materials and neuro resource facilitation for Floridians. In addition, we created a statewide advisory board, half of whose members have lived experience with brain injury. So I want to show you who's on our board and to thank these members, all of whom or many of whom are on this call right now. And so we've been working together with our board here to put together this plan for you. And now we are working to carry out the plan. So our needs assessment, we conducted that needs assessment last year. So we started with a listening session at the Brain Injury Florida annual meeting in May, and some of you participated in that, and we're very grateful for that. And then we distributed a survey that was a 3-part survey. Some of the questions were geared toward survivors, some toward caregivers, and some toward providers. So of the responses we received, we had a goal of about 300 survey responses, and we had 384. So we reached our goal. Half of those survey responses were from survivors, and with about 33% from caregivers and 13% from providers. So what did we learn through this needs assessment? And just to share, we did distribute it through a couple of different listservs, Brain Injury Florida listserv, Brain and Spinal Cord Injury Program listserv, and then through other forms of media and through postcards as well to try to reach people who might not have seen the opportunity online or through email. So some of the major themes that came up for us when we analyzed the survey results, just to explain, most of the survey included multiple choice type questions, ranking type questions, and then a lot of fill in the blank type questions where respondents could share their personal experiences with us. And we went through this data, we analyzed the data. We also used some AI tools to summarize all of the comments from the responses because there were many. So the main themes that came out, the common challenges that we found in these 3 surveys For caregivers and survivors, the challenges involve financial strain, behavioral health support, difficulty accessing responsive care, limited long-term support, social isolation, inadequate communication and coordinated care, and bureaucratic hurdles. Survivors in particularly also felt there was a need for more rehab services, better discharge planning, increased public awareness, better social integration, and access to support services, while caregivers were looking for legal advocacy, interested in more culturally sensitive and specialized rehab, and felt there had been poor communication with their families. So we used the needs assessment to build our action plan. So we took these common themes and we developed them into action items that we felt were of highest priority to the population that we are intending to serve. After we analyzed this data, we also held a writing retreat with the board. So we got together in Orlando and we organized these themes into 3 major strategic priorities. And each priority was then expanded to address the specific concerns that were raised in the needs assessment. So we're going to talk about those 3 major strategic priorities today. Although we came up with 3 priorities that each have their action items, there were values that kept coming up in the survey. And we wanted to ensure that everything that we did would keep these values in mind. And we call these our guiding principles. So the guiding principles include enhancing communication, prioritizing behavioral health, improving quality of life, fostering accessibility, ensuring sustainability. We want to make sure that this plan can be sustained for years to come, that individuals' rights are protected through everything that we're advocating for and the action we take. Individuals' rights are one of our guiding principles. And we want to ensure that we're fostering accessibility and interdependence. So while our action items, some of them overlap with these guiding principles as well, but these guiding principles serve as a foundation to all of our actions. And this is reflected by the survey results or derived from the survey results. So what are our strategic priorities? Well, first, it's to improve quality of life. So this is addressing social integration, emotional well-being, education and employment, self-advocacy, and transportation access. Transportation came up a lot in our survey, so we wanted to make sure that we had some action items to address that. We wanted to strengthen community-based support systems, promote educational and vocational opportunities, and improve access to essential services. So this is how we feel we will improve quality of life. It is also important that we create education and awareness. So in general, how can we raise awareness throughout the state of Florida? Awareness for survivors, education for survivors, families, professionals, policymakers, the general public. We need to provide a better understanding of what brain injury is and how it affects an individual's life and improve access to care from there. So we want to develop a comprehensive education strategy. And we want to develop service system enhancements. So how can we leverage existing statewide systems and services for this community? So this involves policy advocacy, improving and helping people use existing insurance coverage and helping improve insurance coverage. How do we better collect data and expand provider networks? So working with state agencies and other healthcare organizations in Florida to leverage what we have and create new avenues to improve the services that are here in Florida. So the way we're going about this is by creating work groups for each of these strategic priorities, meaning we have 3 work groups. So one work group is to improve quality of life and to work on the action items listed below that. Another work group is to focus on education and awareness. And additionally, there's a work group for service system enhancements. And let me tell you a bit more about these work groups. So our advisory board, the work groups are derived from the advisory board. The advisory board, we were meeting monthly, and now we are going to shift to quarterly meetings. The work group chairs will be providing updates during our quarterly meetings to the advisory board. The work groups will be meeting monthly. Therefore, work groups can, I want to also express that work groups can include people who are not on the advisory board. So we are inviting other stakeholders to our work groups. If there are individuals in Florida who can help us accomplish our action plan goals, then we are opening up the work groups to new members who are not necessarily on the advisory board, but people who are passionate about helping us carry out these activities. So I mention this because I want to look at this group, all of you, as potential work group members, or even if you can recommend individuals to our work groups, people who might be familiar with what we're trying to do and could help us accomplish our goals. So work group meetings are monthly, and we bring all of those activities to our quarterly advisory board meetings. And with that, I will hand it over to Denny Armington, who will be talking about our quality of life work group and the action items that are under that group. Denny is the president of Brain Injury Florida. And Denny, just let me know when you want me to advance the slide.
Okay, I'll do so. Thanks, Jessica. Appreciate the introduction. And it's good to see all the friendly faces in terms of participants. And thanks for joining us, as well as those that we have yet to meet, and appreciate your participation this afternoon. I have the pleasure of participating as a member of the work group Quality of Life. I'd like to talk to you a little bit about the specifics that we derive from the information that we received, and talk a bit about, we've had 2 work group meetings thus far, and some of the thoughts that have surfaced so far about addressing these particular goals. So again, 3 major goals: social and emotional well-being, self-advocacy training, and increasing access to transportation in general, paratransit in particular, and other opportunities for being able to get around and get access to activities, etc. Under social and emotional well-being, there are 3 target areas that have been identified. The first is to improve social integration and opportunities leading to that. One strategy that we've identified for doing this will be to work through Florida Brain Injury Coalition Committee and caucus development to develop legislation and/or funding to influence brain injury clubhouses throughout the state, or development of them. Currently, there's only 1 clubhouse focused on folks with brain injury, and that happens to be at Brooks Rehabilitation in Jacksonville. They do great work, and they've done great work for a number of years. We would love to replicate those efforts throughout the state of Florida. We would do this using the framing provided by the International Brain Injury Clubhouse Alliance, or BICA, as they provide great protocols, if you will, for developing these very effective applications. Actually, they have international, as the name suggests, are international references throughout the world. Another strategy will be to collaborate with Florida universities to reestablish brain injury camps for people with lived experience and caregivers by exploring grant opportunities to help develop summer camps on a go-forward basis. Next page, Jessica. We'd also like to work through social and emotional well-being to increase support group accessibility. Strategies for this will include working through the Brain Injury of Florida to identify and maintain an updated listing of brain injury support groups. We currently have done that. I have currently identified 54, I believe, active support groups throughout the state. focused on acquired brain injury. Many of them are in person, others are virtual in terms of the opportunity, but each of these have been identified with information, contact information, et cetera, for you to access, again, through the website, Brain Injury Florida website. Working through this, through Brain Injury Florida, we also are working to encourage and support the establishment and sustainability of brain injury support groups. We have a number of ways we're attempting to do that, including a quarterly, what we reference as a meetup for participation of the support group leaders to share information that has worked for them in terms of sustaining and building upon enthusiasm for the support group activities. Then also working through Brain Injury Florida and the University of Florida Brain Center to disseminate research and advocacy opportunities within the support groups. So we found that there is a great deal of interest and potential in research, ongoing research relative to improving services and outcomes for brain injury, but also make these things available through things like clinical trials and participation in clinical trials. We also want to advocate for awareness and support for Florida-based acquired brain injury research. And one of the things we hope to develop and maintain is what's been referenced as a research summit. And we're currently in the process of planning that for an activity, a conference next year in conjunction with our annual education conference, hopefully to be scheduled for the month of May of next year. So look forward to information regarding that as we develop it and disseminate it. Next page, please. Our third goal area for improving social and emotional well-being is to improve education and employment outcomes. Strategies for this will include working with disability and education-related organizations and relevant state agencies like Department of Education, the Bureau of Exceptional Education and Student Services, or BEES, to establish a statewide brain injury school reentry consulting program to assist students, schools, and families in implementing best practices for returning to school. We are currently looking at a very successful program, and there are a number of them throughout the country, similar to the Brain Steps program in Pennsylvania. Also working with relevant state agencies, Department of Vocational Rehabilitation and their contractors and community organizations to ensure that employment service providers across Florida receive specialized training and competencies related specifically to brain injury. Next page, Jessica, please. Our second area of focus in improving quality of life relates to self-advocacy training. Again, we have three strategies in this area we will be pursuing. First is exploring and expanding existing advocacy training through the brain injury clubhouses that I've just mentioned and further development of those. Brain injury peer mentoring. Again, much of that could be done through our support groups as we continue to support and grow those advocates, or through this Florida Self-Advocates Network. Next page, please. Second strategy is working through Brain Injury Florida and the Brain Center to develop identification cards or some other form of identification process to inform emergency and medical personnel, first responders, about brain injury in general and specifics relative to the individual they may be addressing or working with. We will also continue to work with Disability Rights Florida to develop and disseminate educational materials regarding supported decision-making to improve and involve people with brain injury. Next page, please. Our third area of focus under quality of life work group is to increase access to transportation. Obviously, many of you, we've shared situations and interests relative to difficulties in gaining access to transportation if you don't have your own car or have the problems with with accessing activities without transportation options. So we're going to focus on that. First is to enhance understanding of the current existing transportation systems and or paratransit, and to improve transportation in adjacent counties in Florida. Many of the focuses currently existing are on a countywide basis. Ideally, we need to make sure that there's more information regarding what currently exists so to develop those opportunities. We will also develop training on use of Florida's paratransit system to enhance mobility. Second is to work with state agencies, healthcare insurers, and other funders to increase transportation options. And I know that our good friend Marlon happens to be here, and he actually was telling me as he participated in our conference in May that his insurance carrier had provided transportation for him to get from his home in Hastings to the conference in Lake Nona. So there are other opportunities in addition to county-supported transportation systems that may be available. We want to make sure that we find those, disseminate that type of information, and develop additional opportunities for transportation. It's such a key to enjoying or improving quality of life. So those are the three focus areas under this work group. And with that, Jessica, would you please take us to the second strategy priority?
Yes, I am excited to talk about how we will create education and awareness in Florida about brain injury. So we have many audiences in mind. We want to improve awareness and education for survivors and families, the general public, talking to employers, looking at policymakers, going into the schools and providing some education, also post-secondary education, and sharing information with healthcare providers. You might think, physicians go through a long educational process, but they may not be as knowledgeable in this population as if they're, practicing internal medicine, for example. So where are there opportunities for us to talk to healthcare providers and share information and resources? Talking to county health departments. There are some amazing things happening in Florida, but they can be county by county. So we want to connect with those counties and their health departments and disseminate information. And looking at managed care organizations as well. So our strategies, really, there's no limit to how we could provide education. Our limit is our creativity. So what we're thinking about public service announcements. We're thinking about Brain Awareness Month and Brain Injury Awareness Week activities in school. Statewide webinars such as this one, public presentations, and podcasts where we can share valuable information that is needed by this community. So how can we expand professional education and training? Well, we're working with Brain Injury Florida to develop an online portal for virtual trainings. They do currently have trainings available on their website, so we're thinking about ways to expand the options available. We're also interested in establishing an ambassador program with Brain Injury Florida so that we can ensure education is being passed on from people with more knowledge and experience to those who might be new to this area. So making sure that we are providing education on how to connect with Brain Injury Florida after discharge from the hospital. And also using the Brain Center at UF to help promote research across Florida and our academic centers. So as Denny mentioned, we're excited to be working on an annual statewide research symposium for next year. And this is an opportunity to bring together experts from UF, FSU, USF, all of the universities and the VAs in Florida, bringing them together to share what kind of research they're doing in this area and how we're advancing care for individuals with brain injury. We are going to work with Brain Injury Florida to help enhance their annual statewide conference. So how can we grow this opportunity? For those of you who attended in May, I'm sure you found it to be just as valuable as I did. It's one opportunity in the year that we can get together and focus on brain injury services and research. Let's make this a bigger conference. More people should be attending it. We want to identify more opportunities for grant funding and collaborate with other universities. You know, one thing that we could use in Florida would be a statewide clinical trial. So if we can get everyone together to talk about what funding might be available to carry out a clinical trial and what does that look like and how do we get this funding? We're exploring those options as well. And working with Brain Injury Florida and Disability Rights Florida to increase awareness of brain injury resources and services with Florida state agencies. So I used the word leverage earlier today, earlier in this presentation, and it's something I want to emphasize because there are services available in Florida. People just don't know how to tap into them, and people might not be aware they exist. So we want to bring together, create resources that bring together services and resources that you may need and disseminate that information widely. We also want to strengthen community engagement and advocacy. So we want to develop a public relations plan to ensure that all Floridians with brain injury and their families are aware of the Sunshine NRF network. So part of this is just getting the word out about what Brain Injury Florida can offer and what neuro resource facilitators, how they can help families. Another of our goals is to host this statewide webinar. So could check that off of our list. But we also want to continue having presentations like this that could be regional summits to educate stakeholders and on ways that we can expand specialized brain injury therapies across Florida. Other ways that we can strengthen community engagement and advocacy is through the promotion and awareness of national professional brain injury accreditations and certifications. There are professional educational opportunities and certifications that providers in Florida could seek out. They just might not be aware of them. Furthermore, how do we get trainees and young people who are looking for professions into these professions? So we want to overall foster a neuro-informed culture of brain injury awareness throughout Florida. So we want people to be aware of how prevalent brain injuries are and in certain communities especially. So in the corrections community, in the behavioral health community, amongst those who might have substance use or issues with homelessness, we want to raise awareness about the potential that a large part of the population might have brain injuries and therefore require a different approach and specific resources. So we want to just foster a neuro-informed culture in Florida so that people are equipped with the information they need to help others. We also want to advocate for improved insurance coverage. And oh, I'm sorry, this is I could just keep going, but I will now hand it over to Drew, who will talk about our third strategic priority and our third work group and what they're up to. And Drew is Vice President of Brain Injury Florida.
Love your enthusiasm, Jessica. Thank you. And I also serve as co-investigator on the federal grant with Dr. Jaffe. For those who are worried about our federal funding, we think that we have good news that the state partnership program is going to survive the cut from the Administration on Community Living and is going to be housed in the Administration on Children and Families, along with the TBI model system, which was also cut in the president's budget. So we're very thrilled that we can continue our work, we may come to you for advocacy to call your Florida federal legislators come August or September, just to ensure that these efforts that you're hearing about today continue to be funded in the future. So I co-chair the Service System Enhancement Group with Jane Johnson, and I'm going to share what we're working on. We actually have 5 major areas of focus that we are working on. The first is advocating for improved insurance coverage and resources for post-acute neuro rehab therapies. And I just want to clarify that most Floridians are able to get their acute rehab needs met through inpatient hospitalization. But what we're talking about in this uh, focus area is what happens to people after they leave the hospital. How much service do they need, and how much service do they actually get? So the first thing that we're doing as far as a strategy is try to increase our own understanding of what is covered under the existing coverages, such as commercial health, um, healthcare through the Florida Marketplace, Medicare, Medicare Advantage, Medicaid, Medicaid waiver, and the B-SKIP program. And then to look at other potential coverage options, such as auto insurance, workers' comp, veterans, personal liability, and county-based children's health services. And what we want to do is get a really good understanding of what all of those coverages provide, and then describe what it is that's missing. And then next slide, Jessica, we will then, once we have that understanding, identify the gaps in insurance coverage and advocate through the Florida Brain Injury Coalition for policy changes to close those insurance gaps. And it could be that we would need to also work with the Florida Brain Injury Coalition to influence existing regulations and propose new legislation to close some of these gaps. And other states have done this. For example, Texas has done it. Massachusetts and Pennsylvania are working on it. Arkansas just did it. Guys, if Arkansas can do it, Florida can do it. Okay. But we want to be very systematic about how we approach this and what we are working towards. Next slide. Our second major area of focus in service system enhancement is to leverage technology to improve access to resources. And to accomplish this strategy, we are going to be facilitating collaboration between Brain Injury Florida and university research centers to try to find someone who's interested in developing and funding a brain injury resource mobile app that survivors, caregivers, and professionals can use. So this is like new app development. And we feel like there's a need for that. Next slide. Our third major area of focus under service system enhancements is to strengthen partnerships and expand service networks. So we want to use the following strategies to accomplish this. We want to work with county and state agencies, advocacy organizations, and healthcare providers to identify additional state agency staff who can serve as resources and advisors to the advisory board and the advisory board's work groups. So like Jessica said in the beginning, the advisory board is what, 16 people, but we need many more people to flesh out these work groups. And so we want, part of our service system enhancement is just to do that fleshing out and find the people that are relevant to each of these focus areas that we can add to the work group. So if you have ideas about that, please email Jessica about that after our webinar today. And then another strategy here is to enhance our brain injury navigation services by collaborating with existing networks such as 211, 988, the Interagency Task Force on Collaboration, and other state agencies, excuse me, to make sure they are all neuro-informed and that they are aware of the Florida's brain injury information line, Beal, and that they are sending people to Beal. So we've already started working on this one. Our work group did. We made application there are 11 211 agencies across Florida, and we made application to become a listed agency that 211 would refer to under the Greater Tampa area 211. And I believe Carrie's on the call, and she's working on making application to the other 10 211s across Florida. And our application was accepted, and apparently we are in the system for Greater Tampa area 211. So that's like, Jessica, that's the lowest hanging fruit that we could find, and we picked it. So we can check that one off. Okay. Next slide, please. Our other strategies under strengthening partnerships include reviewing the data that we get from our ACL grant, from the Sunshine Neuro Resource Facilitation Network, and develop improvements to the network based on the data. So this is part of why we have developed a pretty sophisticated database at BIF. We're using the database called Salesforce, which will allow us to do much greater analysis of the calls coming in, what people are asking for, what our responses are to them, and where we need to make improvements in that. Also identifying needs for continued funding opportunities. So this ACL grant, soon to become an ACF grant, hopefully, is in its second year, and the third year will start. I always forget, is it August or September, Jessica?
September, yeah.
Yeah, and then that's the third year of a 3-year grant, and then we will have some unused funds from the first year that we can ask for a no-cost extension into the fourth year. But we want to definitely look to apply for the next round of funding. Hopefully that will come out of ACF, and the advisory board work group will work on advising that process. And then we want to also work with the Brain Injury Coalition on improving state policies regarding brain injury in Florida, and to advocate for regulatory changes. For example, if we find through our analysis of the NRF data that the people that we're sending to BSKIP are not getting the services they are asking for, we might ask BSKIP if they could look at their regulations and revise their policies accordingly. Next slide. The fourth major area of service system enhancement is to improve data collection and system coordination. And part of the strategies here are understanding and exploring how the BSKIP Central Registry and the Florida Stroke Registry can be leveraged to improve services. So those are two registries that already exist in Florida, and we want to see, well, how are we using them? How can we understand more about people's needs from those registries? And then to expand statewide data collection to include mild traumatic brain injury, because the BSKIP registry only serves people with moderate to severe traumatic brain injury. So we would need other ways to include mild traumatic brain injury, as well as non-traumatic brain injury, such as brain injury caused by anoxia, infection, tumor, toxins, and other non-traumatic causes. Next slide. Other strategies for improving data collection include assessing the capacity of county health departments and federally qualified health centers, local health planning councils, and community health centers to serve people with acquired brain injury. And then the last strategy there is investigating and increasing the availability of telehealth and telerehab services across Florida. Many people who don't live in the more populated areas, but who are in the more rural areas, could be served more with brain injury specialty service if providers were encouraged to use telehealth and telerehab services. Next slide. Our fifth major area of focus in service system enhancements includes integrating brain injury screening into behavioral health services. And at our conference, I hope many of you who were there last month, May 22nd and May 23rd, heard the presentation by April Turner about how they have done this in Alabama. And it's an extremely successful program. Everybody walking into a mental health center in Alabama now gets screened for brain injury and referred for brain injury services if they have a lifetime history of brain injury. Folks, if they can do it in Alabama, we can do it in Florida. Okay, so that's we're going to be working with the UF Brain Center and BIF to develop training programs for behavioral health providers on how they can integrate cognitive strategies into their treatment of folks in behavioral health. So this is all very exciting, and I'll turn it back over to Jessica.
Thank you, Drew. And Drew made a good point that I didn't emphasize enough when we started this. But we are looking at resources for individuals with any kind of brain injury. We do not focus on traumatic brain injury. So we are looking at acquired brain injuries as the list that he went through. But I want to make that distinction because traditionally the TBI State Partnership Program was focused on TBI, but we, in our application, made the point that we want to focus on all brain injury, not just traumatic. So, so it is a wide net that we're casting in regards to who should be receiving these resources and services. So just to quickly mention, the grant is under administration for community living right now. We anticipate that with the changes that are happening at the federal level, as the administration for community living is dissolved, that this partnership program will move into the administration for children and families under the U.S. Department of Health and Human Services. And so I just want to make that point because we have been referring to it as an ACL grant, but it is likely to move into a different department. And that's all we have for you today for our presentation, but we do want to open the floor for questions, and you can either share them over chat. I'm monitoring the chat right now, or go ahead and ask your question. Hopefully we won't have people speaking over each other. But we'll just open the floor right now for any questions you might have. And likewise, I put my email in the chat if you are interested in helping us. Please feel free to email me if there's any specific work groups or any action items within one of the work groups that was interesting to you. You know, maybe it's the clubhouses interest you, maybe it's transportation issues. You're welcome to just join us to focus on that issue. So, you know, anybody who's interested, please reach out to me. So one question.
So I see that Candace has put a comment in the chat about an app that a student at University of Pennsylvania has just developed, and that we might partner with that student to make our app. So I'm thrilled for that, Candace. Thank you for that suggestion.
I'm sorry, Drew, what was the university again?
University of Pennsylvania.
Okay.
I know Pennsylvania keeps coming up, but that's because you got Candace and me
We have a lot
posing
of good
as Floridians. Thank you,
We're going to
Candace.
bring all of our knowledge south. And Drew, I didn't send that to the group, but just to you to see if that would be of interest. But
I think it's a wonderful idea, Candace. So thank you for that.
And to that, note, University of Michigan Concussion Center, Denny and I met with Judy from NASHA earlier today, and she said University of Michigan Concussion Center is also working on an app development, which they are pursuing with grant funding from Toyota Way Forward Fund. So maybe that's another one we can kind of explore as we work on our app. Okay. So we also have a comment from Tim. One thing we need to do is to change current law concerning reporting of brain injuries. The current law omits the many veteran hospitals throughout Florida. And I would absolutely agree with that.
That falls in my area, Tim. Thank you.
And right, and if there's anyone on this call who is aware of which legislators might be most interested in joining with us to advocate for Floridians with brain injury, you know, we're always looking for networking and opportunities to connect.
And along that line, one thing that you might do is to meet with your legislator. In this case, we're talking your Florida state representatives and senators, and tell them about your interest in brain injury and ask them if they would become a champion for brain injury, because we have a number of draft bills that we already have on the table that we're looking for a legislator to introduce into the legislature. But we need someone who feels, we need a legislator who is passionate about this, and you can make them passionate by telling them your stories and finding out if they have a connection to brain injury. There's some more stuff coming up in the chat.
Candace was asking what is the low-hanging fruit and what are our priorities or timeline to accomplish some of these goals? You know, I think in terms of education and awareness, some of the low-hanging fruit might be that we can easily put on virtual presentations like this. You know, we just need to find a speaker and schedule it, disseminate that information, and hold educational, we could do a monthly or a quarterly educational presentation. I think that would be some low-hanging fruit. Also, education in the K through 12 schools, while it's not easy to get into every county in Florida, here in Alachua County, we have a group of, we have a Society for Neuroscience. It's a group of graduate students at UF who love going into the K through 12 schools and hosting homeschooled kids here at UF to learn more about brain science and brain injuries. So I think that there are some opportunities to get into the schools. You know, if we can get the right contact in the county, then we can easily schedule some educators to go into the classrooms to teach kids about brain injury. There's the timeline. We are referring to this as a 5-year plan, but it's also a living document. So that can change in terms of as we add goals and action items, we might expand that timeline.
So thank you, Riley from Representative Leonard Spencer's office for attending, and we would like to meet with you. So we will take down your contact information right now and set up a meeting. Thank you so much. That's exactly what we need. And
Awesome.
then, yeah, great. Thank you for coming.
Now, Mara was also asking about assisting with condominium bylaws honoring TBI survivors. I went to my commissioner and can't hire a private attorney. So what, looking for assistance with that kind of advocacy. I think also one of the things that comes to mind is Disability Rights Florida. They might be a good resource for learning more about your rights there.
Right, and Vanessa is suggesting that we network with Luttrell and Deluzio. They are the U.S. Representatives that co-chair the U.S. Brain Injury Caucus. And I will also just point out that that our national association, the Brain Injury Association of America, is highly involved with them and with the caucus. We are definitely working with them. There will be an opportunity for people to participate at the national level next March, and we will keep you aware of that as it evolves. Our focus with the Florida Brain Injury Action Plan is really on state issues, and so that's why we really want you to meet with your state legislators and tell them about us, tell them about your story, and get them involved.
Okay, any more questions or comments? I do want to thank everybody again for attending. I think this is, just one of the steps in taking to move forward advocacy and improvement of bettering of resources in Florida. And to see so many on this call really gives me hope that we can continue this dialogue and provide more presentations to Floridians in the future, and that there's an audience who wants and needs that information. So I really appreciate all of you being here and participating, and yeah, and I hope to meet some of you through our work groups as well.
I just want to
Thanks,
say
Tim, for your legal assistance resource that he posted in the chat. That's very good to know.
I just want to say my name is Charles Moore, and I'm from Pennsylvania, Texas, and Virginia, and Pennsylvania. Anyway, I really appreciate these meetings. It opens my eyes up a lot, and to see them and totally realize that they are there. And it makes me feel very comfortable and very happy to be here. I cannot offer many things towards what you are going towards today, but I really appreciate you being here for me, for everybody in Florida, in the United States.
Thank you, Charles.
Well,
Thank you, Charles. Thank you. Yeah, I'm really excited about what we're doing, and I think I'm probably the newest person out of Drew, Denny, and I'm probably the newest person to the brain injury area, having worked in oncology for a long time. But what I'm learning is that this is a large population, and my other hat that I wear is in the area of Alzheimer's, and helping with community outreach and education and programs in Alzheimer's. And I think there's coordination and resources in that area, and I think we can use that as almost a template for what we can be doing for survivors of brain injury in Florida as well. So I'm excited to bring together those resources and advocate for the needs of this population.
Now, with that in mind, Jessica, there's also power in numbers, and we need to talk briefly about most recent recognition of the prevalence of people living with brain injury, and the Center for Disease Control, CDC, just produced a published article that recognizes that 20% or more of Americans have identified having some form of brain injury in their life. That is 5 times what we have been dealing with, been led to believe, as terms of the prevalence of this previously. So, and also saw a survey from Association of Retired People, or ARP, that 4 in 10 people over the age of 50 have also suggested that they've had some form of brain injury in their lifetime. So there's lots of us, if we band together to mandate not only coordination of services, but also demand for services aren't currently available, that we bring those into fruition is through workings of these types of activities and commonalities, and working together, we can bring forth efforts and services in these particular areas that we've addressed this today. So thank you for being here. We appreciate your attendance, and we'll look forward to working with you in the future.
And on that note, I would also encourage everybody to join Brain Injury Florida's email list if you're not on it, so that you can get announcements about events and other resources that might be helpful.
We will put you on it, and with the disclaimer that you can opt out if you don't wish to continue receiving emails from us. Okay.
Yeah. And for those who aren't on the emails for Brain Injury Association of America, I would recommend that one as well. Especially for those who are interested in advocacy on a federal level, they often send out information about how we can advocate and what we should be telling our legislators.
So the
Absolutely.
question is, how do you get on the email list?
Well,
Okay.
we can handle that through BIF. We can give emails to national so they start to receive national publications.
Be great.
And yeah, Tim points out that our publications at BIF are the quarterly Brainwaves newsletter that he and Carrie put together. So they do such a great job. Has anybody seen the Brainwaves newsletter? Isn't it great, Melissa? Oh, and Susan. I mean, I just love what they do. Thank you, Tim and Carrie.
Absolutely. And if you do want to be on the email list, feel free to send me your email address, and I can also get those over to Brain Injury Florida if you don't want to post it here in the chat. I also have everyone's email address from the Zoom call, so
That's what I thought. We could add that,
yes,
and then if they
yes.
don't want it, you can
Yes.
just
So if
opt
there's
out. We
anyone-
don't want to
yeah,
pressure
so-
you, you know.
Right, so maybe we'll do that. We'll go ahead and add you guys, and then if you want to opt out, you can opt out.
Thanks, Maria. We have yours.
Yes. All right. Well, we are. Oh, Maria, did you have another question or comment, or was it in regards to? Okay, you're good. You're good. Okay. So, well, it is almost 5 o'clock. So with that, we can adjourn this meeting. But again, we are here and available to you if you would like to communicate with us or share any thoughts. Feel free to reach out to me at any time.
Thank you, everybody.
Well,
Thank you, everybody.
Betty.
Appreciate it.
Thank you, everybody.
Have a great evening.
Thank you.
Thank you.
Great job, Jessica.
Thank you. Good to see you.